kind of agree it's gonna come between a billion to $1.4 billion. I think Spotlight say $1.4 billion, but that's annually. But the sales tax is only gonna get only $330 million. So that's a big gap to 1 billion. I mean, how is the county expecting to get the rest of the money, or like if this doesn't pass? Is the county like working on other idea, other proposal, exploring something else?
So let's talk about both options. If it passes, you're correct that it's about $330 million a year, which is a little bit less than a third of what we need. What is interesting about ballot measures when you're putting something out to the voters is that you want to have some confidence that that measure will pass. So before putting this measure out, we had some polling done, frankly, to ask people, would you invest in this? Is it important to you to save our local hospital systems and other safety net services and preserve county services? And if so, what amount of money would you approve passing? And frankly, if voters had said they would approve $10 rather than 5/8 of a cent, we would do that. So the 5/8 was really as high as our polled voters were willing to go. Another piece that people were interested in was a limitation on the tax. This tax is very much tied to the cuts of H.R. 1. The tax measure that is going on the ballot is just for 5 years, which gets us through, hopefully, to another administration and the beginning of the unraveling of some of these disastrous cuts. And I hope that that will make this more palatable for folks who aren't excited about a tax. Maybe there will be some energy around, okay, we're going to pull together for 5 years. We're going to do this, frankly, because the alternatives are really devastating to all of us.
Rosie?
Yes, Supervisor Ellenberg, in terms of oversight, how can the voters that we're asking to support this be assured that there will be oversight that guarantees that these funds will be used for the purposes that we are sharing? What will be in place to reassure those people in the community?
There will be a citizens oversight committee that's built into the measure that absolutely will check how that will follow how that money is being spent. What is tricky and what I believe critics may point out is that this is a general tax, not a special tax. A special tax, which would require 2/3 of the voters to approve, would mean by law we had to spend the money on the specific things that were noted in the ballot measure. A general tax doesn't do that, so there is some undercurrent of fear that, well, we'll pass this tax and then the Board of Supervisors will decide to spend it on something else, and they won't save the healthcare system, and they won't help people who are hungry, and they won't help people who are experiencing homelessness. And to those folks, I would say, look at our track record. Look how this county spends our money. Look at the board's priorities. Look at where we have invested the money that we do have. And I think I believe with all my heart that we have demonstrated our unwavering commitment to building equity in our community, to providing more resources to the people who have fewer, and to investing in a way that makes our entire county healthier and stronger. So that's essentially the receipt, the promise that you have that we will spend this money as promised. In addition to the oversight committee, there is also an opportunity at every single board meeting to speak up, to make it known if you think that the money is not being spent properly in a dramatic response. A supervisor could be recalled or not reelected to say, if people believe you didn't fulfill your promise, this isn't how you said you would spend the tax, you're out of here. And I think, frankly, that would be a fair response.
I think you responded my question, but I want to throw it in there anyways. And this concern has to do with the Silicon Valley Taxpayer Association.
Mhm.
They say the county restriction for new money coming in basically is to spend it in the county. But I guess the question was asked with the oversight committee and with the explanation of your track record, how you spending the money. And I don't know if you want to expand on that, but I want to ask if how can taxpayers be sure that this temporary tax until 2021 won't be extended permanent? Because in politics, as far as I know, a lot of temporary things turn out to become permanent issues of permanent taxes. So how can we make sure this is 5 years and then it's going to stop?
Because by law, the tax will end. If it becomes permanent, that does happen sometimes. It will be because the voters renew it in 2030 and say, you're doing a good job with this money. We want to keep providing it. It's not going to cost us any more. You've done what you said you were going to do. Maybe, God forbid, we're not out of the woods yet with Medicaid and other resources, but truly, these taxes can only continue if the voters reapprove them.